The tools for achieving your wellness goals are right outside your door. You just have to know where to look, and I'm here to help. I'm Missy, an East Texas Christian herbalist, here to share conversations about local plants, where to find them and what to do with them, local vendors, the area's top sources for natural health products, and local practitioners, the professionals you can trust to get to the root of whatever you face. Whether you're here to learn, connect, or live more in step with the land, you're in the right place. Welcome.
Today, I want to dig into traditionally used herbs for blood pressure and high blood pressure in particular. Questions that I hear a lot. People ask, how can I lower blood pressure naturally? They ask, is there a way to use herbs to get off blood pressure medicine or to take less? Or how much does diet and lifestyle really matter for high blood pressure? And these are questions that I understand the complex emotional intensity behind them, because around 3 years ago, my still relatively young husband had a heart attack. Cardiovascular health mattered before that, but it at that point literally became a matter of life and death, and a large part of my focus when I talk to people or read about blood pressure issues, it's hardly ever low blood pressure they're worried about, probably because statistically, way fewer people have low blood pressure causing issues, and for so many, high blood pressure can be frightening because of its implications. So today, I'm going to start off with some information on high blood pressure in general, and then we'll talk about diet and lifestyle before we get into herbs. So this one, it's going to be a longer podcast, but it's important to me and I want to be thorough. So if you just want the herb part, I'll try and put the timestamp for that portion in the show notes so that you can just skip on ahead. But let's dive in. Blood pressure measures the force of the blood pushing against the arterial wall. Think water pressure at the spigot when you turn it on. So you can turn it on just a little bit and it might come out the hose in a trickle, or it can blast so hard that it kind of hurts. Blood pressure is most often measured at the brachial artery by placing a cuff around the arm and attaching it to a manual or an electronic measuring gauge. You may have one of these at home or that you use, or you might just have it taken when you go to the doctor. Blood pressure is reported as two numbers, a top and a bottom, which measures systolic, the top number, and diastolic, the bottom number, and both of these together indicate blood pressure. Systole is when the left ventricle of the heart contracts, it squeezes, and when it squeezes, it pushes blood out through the arteries away from the heart. Think systole, squeeze. That's how I remember those two. Systole, squeeze, systolic, squeeze. That top number is the squeeze of the heart. Diastole is when the left ventricle relaxes, allowing the heart to fill with blood again. So the pump squeezes all the blood out and then it relaxes so that it can fill with blood again. So I guess if you wanted a D word to remember diastolic, you could go with decompress maybe. I don't know. Systole, squeeze works for me, and so I just know the other one is the other thing. As far as what's healthy blood pressure, what's high blood pressure, what's low, numbers have changed over the years, but currently the American Heart Association goes by the following guidelines. Normal blood pressure has a systolic number of 120 or lower and a diastolic of 80 or lower. Elevated blood pressure, the top number is between 120 and 129, and the bottom number is between 80 and 89. Stage 1 hypertension, you have a top number between 130 and 139, and a bottom number between 80 and 89, and then stage 2 hypertension is 140 and up, and 90 and up for the bottom number. Blood pressure fluctuates from 1 minute to the next. It fluctuates rapidly and a lot. It's impacted by mood, by how you feel, by what you eat, by how much you've moved recently, and other factors. And that's why the American Heart Association recommends that blood pressure be measured over 2 or more occasions to establish a baseline reading. So don't just take it once, take more than one reading, because getting an average can help you get a better picture over time, especially. Again, blood pressure is impacted by mood, by how you feel, by what you eat, by how much you move, and other factors. It's not just one thing. So you may not be able to just address it in one way with one solution and see permanent improvement. I can't stress that enough. Just because one approach doesn't work, one herb or one medication or one lifestyle change doesn't shift your blood pressure back into a healthy range. That doesn't mean that that one thing isn't any good. It just might not be the right solution for you, or you might need to add to it. Long-term, untreated high blood pressure, also known as hypertension, makes the heart work harder than it should have to. The heart's a muscle, so when it works harder, it gets bigger, eventually enlarging the heart and potentially leading to other serious complications like hardened arteries, myocardial infarction, that's a heart attack, stroke, and kidney damage. Hypertension also affects other organs, including the brain and the eyes. One huge factor, and one that always important to address, is inflammation. Inflammation occurs throughout the body as a normal response to irritation. When something gets irritated, it becomes inflamed. It can also be because of injury or the presence of pathogens. Too many lipids, too much LDL cholesterol in the blood can act as an irritant. Chronic high blood pressure is an irritant. Toxins from cigarette smoking are irritants. All of these things damage the endothelium, the one cell thick inner lining of your blood vessels. So if you have constant irritation going on, there can be just low level constant damage going on. And when that damage occurs, the body says, hey, there's inflammation and damage here. We need a repair crew. So in response to that call for help, the body slathers on basically a patch, kind of like you might put chapstick over cracked lips to soothe and protect them. The body does that inside in the endothelium where there's damage, but that patch contains cholesterol, and the cholesterol accumulates. Immune cells try to clean up the extra, but some of them die and stay where they fell. And over time, the cholesterol and the dead macrophages and other patch and cleanup materials build up further to form arteriosclerotic plaques, and all of that buildup contributes to coronary artery disease. So the walls become stiffer from all the stuff that's built up on the inside, and they become more narrow again because of all the buildup. So there's a lot more to the process that I won't get into, but the body's response to irritation over time causes arteries to get more narrow, less flexible. The heart has to work harder, and that's why inflammation is one of the primary factors in the development of atherosclerosis. That one's a hard one. Don't try saying it too fast. Ongoing inflammation is bad for circulatory health. That's why modulating inflammation is a top priority. Diet, lifestyle, and herbal support all play a role. We're going to talk about herbs for high blood pressure in a minute, but I can't stress enough that the solution often isn't just taking a pill. It's not. What you eat matters. How much you move matters. Modern medicine is amazing and it can solve a lot of issues, but if you give your body bad fuel, it's going to gum up the parts. It may not be possible to just swallow your solution to get that inflammation down. You very well might have to adjust other areas of your life. Eating whole, unprocessed foods, high in phytonutrients and antioxidants, as well as monounsaturated fats found like in avocado and nuts, and avoiding inflammatory foods like sugar, alcohol, and processed foods may help avoid many types of heart disease. So bring in colorful fruits and vegetables are full of anti-inflammatory phytonutrients, and so are a lot of herbs. Dark red, blue, and purple berries, like blueberries and cranberries, are especially helpful for heart health because they're rich in antioxidant and anti-inflammatory compounds. These compounds promote circulation. They protect the cells from oxidative damage and keep the vascular lining, that endothelium, healthy. So I encourage people to aim for a cup of berries a day. That's a good idea for everybody, and especially if you're wondering what are things that I can do on my own at home to help support the body when I'm dealing with high blood pressure. Tomatoes, watermelon, green and purple cabbage, all of those contain lycopene, and lycopene is cardioprotective. It regulates cholesterol synthesis in the liver and has anti-inflammatory effects. EFAs, essential fatty acids, omega-3s, help decrease inflammation, and they may reduce elevated triglycerides. Fish oil, flax seeds, algae, chia seeds, wild rice, leafy greens, black beans, salmon, herring, and mackerel are all good sources, so all good things to also add into your diet. Soluble and insoluble fiber from oats, barley, legumes, flax, psyllium seed, apples, pears, and citrus fruit is all a good idea. Insoluble fiber is found in most vegetables and whole grains, and that's good for you too. So try for a pound of vegetables and a cup of those bright red, blue, or purple berries every day, and then add in your essential fatty acids and lots of fiber, and you have made a huge step in the right direction. I mentioned exercise. Regular, moderate exercise is beneficial for the entire body, not just for the cardiovascular system. And try this. This is something that we've noticed at home. Measure your blood pressure and then get in moderate exercise for 30 minutes or so and check it again. And I bet you're going to be surprised. When you exercise, you improve blood pressure, pulmonary function, blood sugar, and overall metabolic function. Plus, you reduce the risk of anxiety and depression. You bathe your brain in freshly oxygenated blood to banish brain fog. You sharpen cognitive skills and reduce the risk of developing even some types of cancer. So doesn't that make you want to move? You could always take a walk while you're listening to my podcast. Just saying, this is a long one. You could get in a lot of steps. Stress reduction and adequate sleep matter too. Inadequate and poor quality sleep are associated with an increase in hypertension and cardiovascular disease. And that's probably because chronic sleep debt, it leaves us in sympathetic fight or flight, which causes an increase in stress hormones that promote vascular inflammation. Last diet and lifestyle tip, drink water. Our bodies consist of 70% water, and when we don't drink enough, it responds by retaining sodium and water, which can raise blood pressure. How much water is enough? There aren't really established guidelines for recommended water intake, but a general rule is between 90 and 125 ounces a day, depending on your body size. So the amount of water varies depending on how much you move, on your climate. Like if you're going to go outside and move around in the heat a lot, you're going to need more than you are if you're sitting in your living room in the middle of winter. Diet also plays a role. A good starting place is to aim for half of your body weight in ounces. So if you weigh 100 pounds, you need 50 ounces. If you weigh 150 pounds, you'd want about 75 ounces, and so on. Okay. Herbs. We want to fight inflammation, modulate stress, support the heart muscle itself and our arteries and veins, and we're probably also thinking about cholesterol. So we're going to focus on herbs traditionally used to do those things in those ways. Anti-inflammatory herbs that also have other heart-healthy actions include hawthorn berry, ginkgo leaf, garlic bulb, turmeric, green tea, reishi, ashwagandha, tulsi, and trefoil. And so we're not going to talk about all of those, but there's you a list to start with. And let's look at a few of those in more detail. So first off, hawthorn, Crataegus species. Its actions are anti-inflammatory, antioxidant, cardiotonic, hypolipidemic, which means it has a reputation for its impact on cholesterol, hypotensive, which is blood pressure lowering, and nervine, which is emotional support. Hawthorn is probably the most reliable cardiotonic in Western herbalism. Herbalists call it a tropho-restorative. That's saying it basically has a positive impact on the whole cardiovascular system. It's been used for angina, that's heart-related chest pain, high blood pressure, atherosclerosis, even early-stage congestive heart failure. Now, if you've been through a heart attack or walked alongside someone who has, you know the period after can be tough mentally and emotionally, not just physically. It's not just a physical recovery that people are facing a lot of the time. There's an emotional and mental toll. And a lot of emotions come up, and fear and grief are often at the top of the list. Myocardial infarction, heart attack. Myocardial infarction is like literally means that heart death. It's death of the heart muscle. The physical broken heart can also go with an emotional broken heart. So the heart is broken in this situation, and it needs time to mend. There's been an actual physical death of a critical part of one's anatomy, so grief just makes sense. It's also it's really common to have a shift in the way the person who's had the heart attack views themselves. It's a sudden, inescapable reminder that we're fragile, we're vulnerable, and the fact that everything could be lost in an instant. And unfortunately, that's not really under our control. Health has been lost, function has been lost, and grief results. And then there's fear of what could have happened, fear of what could happen tomorrow because of this new vulnerability. The whole future all of a sudden seems to have a whole lot more uncertainty than it did just a relatively short time before. So these negative emotions, they hit for very good reason, and thankfully there are herbs for that. Hawthorn is one of them because it acts both as a physical and emotional heart tonic, helping soothe heartache and rebuild emotional resilience. Getting back to the physical part, Hawthorn supports the heart itself by boosting circulation to the tissue that makes up heart muscle. It improves coronary circulation to the myocardium, to the heart muscle itself. It increases contractility, gently strengthening the heart's own pumping action. It has antiarrhythmic action, so it supports a consistent heart rhythm. But wait, there's more. Remember I said Hawthorn's a tropho-restorative, good for the whole cardiovascular system? It doesn't just work on the pump, but also the connected plumbing. The berry, Hawthorn berry, contains flavonoids that relax blood vessels and exert anti-inflammatory, antioxidant effects throughout the body. Blood's able to travel more effectively to the extremities, to the hands and feet, and this reduces strain on the heart itself. Nice, huh? In terms of safety, Hawthorn berry is generally regarded as safe and not thought to interfere with other heart medication, although it's always a good idea to check before you incorporate any herbs or any supplements into your regimen or change anything that your doctor has told you to do. The recommended dose is 12 grams of dried berry, which is a lot. So for this, I use an extract over just dried and ground up plant. An infusion of 1 to 6 grams of aerial parts, or if you're using a tincture, 2.5 milliliters 3 times a day. So how long does it take for Hawthorn to work for blood pressure? Well, you have to be patient for this one and stick with it. Significant reductions in blood pressure have been observed after 10 to 16 weeks of consistent use. Garlic's another one that comes up a lot when you hear people talk about herbs for high blood pressure. The aromatic compounds of garlic work in the body, as many aromatics do, by dilating blood vessels, opening and relaxing circulation. There's more space in the blood vessel, so less force is needed to allow the blood to go through to get circulation where it needs to be. Less force hopefully translates into less ongoing damage, less long-term inflammation. Research shows improvements when the equivalent of 1 clove of garlic is used daily for at least 4 to 6 weeks, which indicates that garlic, as a part of the daily diet, can support healthy blood pressure. In studies done with people who have average blood pressure, their measurements didn't decrease, which indicates that garlic wouldn't be contraindicated for someone who has normal or low blood pressure. So if you're interested in blood pressure for some of its other benefits, but you have low blood pressure, that doesn't necessarily mean you can't take it. Herbalists also sometimes bring up garlic as a natural hypertensive to use during pregnancy. Of course, pregnancy is especially a time when you want to talk over what you're thinking of taking with a knowledgeable practitioner before you start or change things. Studies have been done with garlic alone and with people who are on statins. Both have shown that garlic has a positive effect on halting and sometimes even reversing atherosclerosis. I think of garlic and hawthorn as long-term, slow and steady herbal allies for hypertension. Now, let's shift gears a little bit and look at a few with a little bit faster impact. If you need something that isn't going to take 12 weeks before you know if it's the one for you or not. So the next herb is dandelion root, Taraxacum officinale. This one is completely different. It works in a different way. It's a diuretic, and with hypertension, diuretics are often given because if you reduce the amount of fluid in the system, you reduce the amount of pressure that fluid can exert. There's less there to push. Many diuretics cause the body to excrete magnesium, potassium, and sodium along with all that fluid. So when levels drop of those nutrients, it can cause muscle cramps and weakness and GI issues, even arrhythmia. So some diuretics can be problematic, but the nice thing about dandelion root is that it's actually rich in those nutrients, especially potassium. So it contributes potassium instead of stripping it. If a diuretic has been helpful in managing your blood pressure, dandelion root might be one herb worth looking into. Because of dandelion root's role in fluid management, it's also used for water retention, for urinary or prostate infections, for gout and arthritis. It has a strong action on the liver, so it's also looked to in cases of gallstones and jaundice. Hibiscus is an herb I love for all things cardiovascular because it tastes good and because it's such a pretty color. I make it as a tea at my house, but it's different in flavor than iced tea or sweet tea you might get at a restaurant. It's sweet and sour and a little bit thicker, kind of almost mouthfeel, almost more like a juice. And the color, it's this beautiful, vibrant crimson. It feels festive, and just seeing it in a glass. If the person with high blood pressure likes flavored beverages, especially sweet ones, this one's worth looking into. Several studies, including randomized controlled trials, found that hibiscus is effective for reducing blood pressure in hypertensive patients. So, general takeaways from the research. This is a number of studies and meta-analyses. Tends to find systolic blood pressure reduced between 5 and 10 points. And diastolic blood pressure going down between 3 and 5. Hibiscus has been shown to have stronger effects for people with mild hypertension or those with a higher starting blood pressure, and has been in studies comparable to lifestyle interventions and some mild pharmacological effects. So far we've said hawthorn and garlic are just good, solid, long-term options for both the pump and the pipes. Dandelion when a diuretic is helpful. Hibiscus, an option for people who like flavored beverages, want a simple lifestyle change that doesn't feel like taking medicine, just a nice tea to enjoy. Now let's get into what we can do when stress is part of the picture. Nervines are a group of plants thought to support, calm, and nourish the nervous system. They're often brought in to help let go of tension in the body, to help one drift off to sleep, to aid in stress-related digestion issues, or to modulate what the body does when it senses a threat. So the next few herbs are in that nervine category. They're nervines that have an affinity for the physical heart. First herb, nervine with an affinity for the cardiovascular system, is Motherwort, Leonoris cardiaca. That's its plant name. There's a clue to its use in the binomial Leonoris cardiaca, heart of a lion. Motherwort is well known for two things: its role in women's reproductive health and its action on the heart. German official medicine uses Motherwort for nervous cardiac disorders, also, interestingly, as an adjuvant for thyroid disorders. Traditional Chinese medicine uses it for coronary heart disease. Studies show Motherwort has antispasmodic actions within heart muscle cells. In lab experiments, it's been shown to reduce blood pressure. One of my favorite herbalists, Richard Whalen, uses it for palpitations, arrhythmias, skip beats, and so on. And he says the difference in heart function when Motherwort is combined with Hawthorn is reliable and palpable. Oh, I like reliable and palpable. So how much should you take? Whalen emphasizes that palpable, when you feel a difference. He says when he gives clients the right amount, they visibly relax. So here's what you're looking for. Shoulders drop. Breathing deepens. Their color improves. They feel it. So for many, Motherwort starts working right away. A dose might be between 10 to 20 drops in his clinic. Next herb is linden, Tilia species. It goes by a number of different names. This is a tree. I saw it the other day at a park in Palestine, and the tag said American basswood. So besides linden, I've also heard European herbalists refer to it as lime flowers a lot. A lot of names, same thing. Tilia species trees have been historically used for treating heart issues like pulsating headaches, high blood pressure, shortness of breath. They're highly regarded for improving sleep, in helping with tension and anxiety. When the issue's caused or compounded by constricted blood vessels, the saponins and flavonoids in linden are thought to have both antispasmodic and relaxant actions, and that means vasodilatory effects. Herbalists included in formulas to relax in the short term and long term to potentially reduce hardening of the arteries. So in the short term, you kind of have that feeling of relaxation when you ingest it, and long term that relaxation can lead to further benefits. It's also diuretic, so the same things we said about dandelion root comes in here. The main difference in my mind is dandelion has a strong association with the liver, and it's in my experience personally seems to be a stronger diuretic, where linden is more used for the heart and not quite as intense. I love linden as a tea. It smells good. And every time I open the jar, I just have to stick my nose in there and take a big whiff. It's beautiful. Close to the beginning of my herbal journey, I heard linden described as a hug in a mug, and that's how it stayed in my mind. A hug in a mug. Doesn't that just sound nice and comforting? So far, we have hawthorn and garlic for long-term general all-around use. Dandelion root, where diuretics help, and the kidneys and liver could also use support. Motherwort for the heart of a lion when there are palpitations or arrhythmias, and linden as a hug in a mug. I'm trying to give you both repetition and some hooks to hang things on, because man, when I started, it was like herbs are used for so many different things. And I think if we can start kind of putting them in cubbies and then adding to that, it's easier for our knowledge to grow and for us to access it again. Several months ago, my husband and I visited a friend who's also into herbs, and he was shocked that I didn't have my husband on cayenne. That's one I hear a lot of people say did wonders for them, that they take it for high blood pressure. They take cayenne for high blood pressure, and I believe it, but it's not for everyone. Why don't you have him on cayenne? He asked, like this incredulous look. Because it's not constitutionally appropriate for him, I told him, and he looked at me like I said something off the wall. Constitutional physiology and herbalism is the evaluation of an individual's unique, inherited, and acquired bodily patterns like their metabolism, their tissue state, their energy levels, to determine the root cause of health imbalances. We'll go into that another day, but it's another way of saying one size fits all. And that's part of what I do when I sit down with clients. We look at the things that make them unique and work to identify which herbs are most likely to work within that uniqueness. There are a lot of herbs for blood pressure, but they do different things for different people. Getting back to cayenne. Cayenne's a well-known herb for supporting the cardiovascular system. It contains compounds called flavonoids that act as antioxidants, helping protect cells, especially those in the circulatory system, from damage. Cayenne may also help reduce platelet adhesion, which means it can help keep the blood flowing more smoothly rather than sticking together and forming clots. There are studies showing that cayenne might be beneficial for improving cholesterol levels, and another 4-week study that tied cayenne consumption to a reduced resting heart rate. So good things. From an energetic perspective, cayenne's considered a powerful stimulant for both digestion and circulation. It helps move stagnation and encourages the flow of blood and digestive fluids. So think of what happens just from tasting cayenne. You taste it and it immediately stimulates saliva and it increases your stomach secretions. It gets things going. But the thing is, some people don't need to get things going any more than it already is. They don't need stimulation, and for them, using strong heating stimulants like cayenne to address cardiovascular issues like high blood pressure might actually worsen the underlying pattern. My husband already carries qualities of heat, intensity, and inflammation. For him, and individuals like him, high blood pressure often arises from inflammatory processes, irritability of vessels, or excessive internal heat. Adding a strong heating herb can potentially aggravate those tendencies rather than calm them. As a stimulant, cayenne can increase heart rate if one's heart is already pumping hard due to stiff or partially blocked vessels or an already amped up system. This extra intensity, it's risky. It's like fire on fire. The system needs to be cooled down, not heated up. Sedation, not stimulation. Cayenne can be too intense for a naturally fiery constitution and may increase inflammation and irritation. On the other hand, cayenne can be very helpful for people whose cardiovascular issues are more related to stagnation, to sluggish circulation, to coldness, excess lipids, or metabolic slowdown. In those cases, cayenne's warming, stimulating qualities help improve circulation, move congestion, and support metabolic activity. Cayenne can be a powerful cardiovascular herb when used appropriately, but in constitutional medicine, the same herb that helps one person may aggravate another if their underlying pattern is different. So if you or someone you know are researching herbs for high blood pressure, that gives you a good solid start. There are a lot more herbs to pull in, but I wanted to focus on the ones that stand out first in my mind when somebody says, hey, what do people use for this? And if you want someone to help you get more precise based on your specific situation, that's what a clinical herbalist does. We look at a person's symptoms and provide education on the herbs that match. So if you want to know more about that, check out my website at gracerootedherbalist.com. Until next time, stay well and God bless.